Well, during the pandemic, there were a slew of social programs and extended benefits put in place by state and federal governments to help people most at risk. Now that the public health emergency has been lifted and the federal government is repealing protections, it's leaving some people without that safety net. Between additional SNAP benefits lapsing soon and a historic rise in inflation, local food banks worry food insecurity is next. Our Lauren Kostick talks with organizers about their concerns for longer lines.
About a week ago, the state's public health emergency ended after being in place for nearly 2 years. House Bill 1001 giving the governor the ability to sign the declaration. But at the same time, that bill cut off enhanced SNAP benefits for thousands of Hoosiers.
It was disappointing.
At the beginning of the pandemic, the federal government allowed families receiving SNAP benefits to get the maximum amount. But now that extra funding will end April 16th, despite the federal program lasting till June. And when programs like this end,
we can see the immediate effect in longer and shorter lines at several thousand locations across the state of Indiana.
John Elliott, the president and CEO of Gleaners Food Bank, says just because COVID cases are down doesn't mean families aren't still dealing with the effects of the pandemic.
Whether it's an April cutoff on SNAP supplements or May or June or whenever that happens, that's still a long time for when we're going to see full economic recovery.
He says the cutoff comes at a time when food inflation is also skyrocketing.
It's one trigger at a time that has been piling on these households. And now the price of food, the price of fuel have both hit those families hard.
An impact that's also hitting Gleaners as they deal with longer lines, supply chain issues, higher operating costs, and a shortage of workers.
So it's a double hit. Impact on neighbors, impact on the Gleaners budget.
With a month left of extra funds, not only Hoosiers, but also food banks are preparing for the change.